we all have to be on the same page here because this is where we can get lost. And so let's define the language and the terminology so that when we use these terms, everybody understands what we're talking about. And the two things you got to leave here knowing at a minimum are the top two in bold, and that's STL and DICOM. Most of you guys are probably familiar with that. So STL, this is a common standard 3D object, common format. This is the file that's coming in and it's a representation of the teeth. So when you have your intraoral scanner and you're scanning, it's creating an STL, and that STL gets brought in alongside the DICOM. STL doesn't have color, and which is fine for what we're doing. Most of the time, the color is more helpful for defining crown margins for our lab. Obviously, our scanners are scanning in color, but when we're exporting them, usually the file that we're pulling out is called an STL, and it is black and white, and it's just a neutral 3D object, no color, STL, and it's a printable object. So this is something that you can actually 3D print, and it has an exact size, dimension, shape, and position in space. And so that's this STL file format. And then .dcm, that's our DICOM. This is what our CBCT pushes out. So this is our bone, our structure. This is when we hear the term DICOM. It's a file that you guys may have seen if you try to export these things. Sometimes you get a folder with like a billion little files in it, and you're like, what is all these files? Which one do I use? Well, you export it as a multiple file export. So you export it as a folder with like 1,000 individual images or slices in it. I like when you have the option just exporting it as a single file. So when you guys are opening up your CBCT, you're just going to see one file. It's .dcm, that's your DICOM, one file that houses every image or slice of that entire 3D object. So when you're exporting, think, well, I should export as a single file. It's a lot easier to manipulate with it. These are our two different file types that have color. So when you see color on here, .ply, .obj. So ply, I think, is what the iTero pushes out. OBJ is a lot of times what the face scanners push out. Again, I'm not as interested in these for our application today. We're thinking more just black and white. We need an STL for that. The last thing is, I want to touch on this because I get this question a lot, is that when you go to in a software and you go up to File Save and you save your scene, or you save your application, you save where you're at, you're saving it as a blue sky plan file, right? So like a .bsb. And so a lot of times people are going up, they're like, I went up and I hit File Save. Why won't it open my surgical guide? Well, you just saved the blue sky file. It's like you saved the Word document. What you really want to think about is more the terminology export. So there's a difference between saving and exporting. And when we create something and we want to go take it into a printer, we want to think export, not save. So get that kind of into your head, because when you're in Blue Sky Plan, you hit File Save, you're saving a .bsb. And that you can't drop that into a printer. That's a BSB. If you double click that, it's going to open up Blue Sky Plan and all the stuff that you designed. If you hit File Export, that's going to save us an STL. That I can drop onto my printer. So think about that. All the different softwares that we use have their own file types when you save them, but you're saving them as a file that's referenced to that program, not a universal STL. So just remember that. Think export, not save. Like, we want to save our work, but when you actually want to go use it, we got to export it.